Welcome, everybody, back to the Waismann Method podcast. I'm your co-host, Dwight Hurst. I'm going to be joined in a minute, of course, as always, by Clare Waismann. David Livingston, also going to jump on the line. We've got a pretty special question today, at least it's special to us here at the Waismann Method. We have a couple of different focuses that we have. It's well known as we talk on this podcast that we do rapid detoxification to help people get over the chemical withdrawals and introduce themselves into the pursuit of health and sobriety. One of the exciting things that is attached to the program is actually what we've referred to before, the Domus program. We're going to be talking a little bit more about what the Domus program is and what need that fills. It touches a lot of areas that have to do with aftercare when you've begun a journey into sobriety and once people have detoxified. So let's learn a little bit more about this main question of what is Domus and what do we do there and why do we do it?
Domus started recovery center for patients going through medical detoxification in the hospital, mostly rapid detox. We started rapid detox over 2 decades ago. But early on, we understood that sending patients right after detox to a hotel room, sending them home was irresponsible, unfair to the patient and to family members, because patients go through a tremendous transition, physiological transition that affects them physically and emotionally after detoxification. Possibilities of relapse are huge because they don't have tools to deal with those discomforts. Their body is hypersensitive to any unwanted feeling because they have no endorphins. Emotionally, a lot of things are surfacing at the same time because that blanket has been taken away from, them, between them and life, on life's terms. So that's the reason we created Domus. Because, again, and our second option was sending them to treatment centers. The problem with treatment centers is you just detox a patient. Now you put them on meetings 3 times a day, and other people talking about the drug, what was when I used the drug, and, talking about trauma, and it was too much, too soon, what made them crave and want to use.
I know that's a big concern, is not wanting to re-trigger, and I know you're also very big on not over-labeling right out of the gate. Here, let's start you out, and let's just do the same thing with you that we do with everyone else. You kind of lose that control when you refer, right?
Right. And most patients that came to us at that point had been to 5, 6, 10 rehabs, and obviously, did not succeed. So we wanted to give them something new, where we physically detox them and found a way to keep them for short term with us to help them physically regain their strength while emotionally becoming a bit more stable. So hopefully we could diagnose, the root of the issue, or at least have a plan. What's the best foot forward after that? If that was following a psychiatrist, a therapist, even going to a treatment center, whatever it was, it would be unique to the person's need and not as a preset protocol. So that's how Domus came about.
Wow.
Throughout the years, and especially with COVID right now, the inability to put patients in the hospital made us use our license to the extent that was provided to us. Also using as a medical detox. So although we will not treat patients that are their health are compromised or very high dosages or on medications such as Suboxone or methadone that have such a long life, we do treat patients, on Oxycontin, patients on heroin, and Dr. Lowenstein is able to give them medications to blunt the withdrawal response. So actually, patients have been doing quite well on getting detox at Domus. They rest a lot. They have support 24/7, and they get through the detoxification, while being supported physically and emotionally.
Wow.
So, Domus, right now, I am hoping that, we are going to start bringing more patients straight to Domus, and some just for a day for, more physical examinations and evaluation at the hospital, and also as a recovery center for the patients that go through sedation detox.
It's interesting.
So it's a very unique place.
Yeah. It's really interesting how the pandemic situation is sort of requiring innovation in all sorts of different areas. And that's what you're talking about, really, is kind of adapting to the need by using a different space. Have there been any of those things that you think you'll keep after, things settle down with being able to use the hospital again? Will Domus still be able to double
I think that's what I was telling you. I think at this point, bringing patients straight to Domus that are healthy and have no need for the hospital, A, is less costly for the patient, and B, some patients are just very uncomfortable and get very anxious in a hospital setting. So I will keep the detoxification at Domus.
That's another level of personalization then, to be able to offer that as well. That's
Correct.
Interesting. Yeah.
Correct. And again, nothing's set in stone. I mean, if the patient is there for a day or two, and we believe that they do need, hospitalization for a day or two, plans can always change. Patient safety and well-being is number one, regardless. It's just offering more options. I think being able to have options is a wonderful thing in life, and we're just being able to offer more of that.
So let's tell me a little bit about what happens if I'm a patient, maybe I've gone through detox, and I walk into Domus program, Domus Retreat. What happens to me? What's the treatment there like, and what am I going to likely experience?
So before you even come in, you do have a consultation with our medical director on the phone. And if there is most of the time there is any pre-existing psychiatric conditions, then you also talk to David. So there is a consultation. I wouldn't even say an evaluation, but a consultation before they even come in that gives patients, because we receive patients from all over the country, gives patients an idea of how long they will need to be with us. Again, we do not require 30, 60, or 90 days.
You're not big on the automatic numbers thing, right? It goes against
Correct.
The whole individualization.
It is, because I believe, for some patients, being away for 30, 60 days is detrimental. By the time they get back home, there is not much for them to come back to. So there is an evaluation of, their productivity at home, their risk of being home, the level of care they will need inpatient. So putting all that together, we can come up with a plan. 10 days, 14 days, whatever it is the patient needs. So once the patient comes in, they will see Dr. Lowenstein, so he can do, a medical examination and find out what medications, they will need in order to get through the withdrawal as safely and as comfortable as possible. Those medications are adjusted throughout the stay of the patient. So again, what he believes in the first day is just, to cover that patient as we start learning the patient's metabolism, and also psychological issues have a major impact of how patients feel physically. If patients are anxious, that they will feel things more intensely. Patient's history or sleep disorders, all that will play, a part on what he will give the patients. Patients, if he believes they need, they also go to the lab and have a full lab done. At this point, we are requiring patients to test for COVID at least with a minimum of 2 days before they come into Domus as well.
Yeah, you don't want that to break out in that environment. It's
correct. So we've been very lucky, knock on wood, throughout the year that we have not had any infections at Domus. So we are hoping to keep it that way. I'm very strict on cleaning, and I have bought hospital grade virucides for every possible corner of Domus. So we've been on top of that, as much as we can. Throughout the beginning, one of the things that we have at Domus is individualized therapeutical services. What they will receive and when they will receive also will be based on how they're feeling. The privacy, of the patients and respecting where they are is another reason why, Domus maintains all private suites. You don't have to share rooms. That means share your experience of where you are or somebody else is. Somebody is extremely anxious and likes to talk, a lot. They should not, disturb your own needs at that time. So everything, not just the therapy, a place where people can read a book or, listen to some music away from others. So we don't have groups. You don't have the need to share with strangers all your stories. If you feel like sitting with somebody and sharing outside, that's up to you. But, we don't require that. Sometimes people are just not ready to share or to dig in and what is good for them at that time. And I think that goes with David as well. When David meets them, I'll let him tell you a bit more about that. But I think every service from emotional therapy to physical services of yoga and acupuncture and drama therapy, whatever that is truly going to be based on, their state at that moment.
Right. I was curious about that, David, when you're in that situation where you've got, a relatively short amount of time that you're working with the patient. How do you approach that as far as how do you set goals or what kind of interventions do you use?
If somebody, and most people who come in, not everybody, but most people really actually want my help. And when they, and then when I can begin to talk to them in a way that feels useful, in a way in which they feel like I'm actually really seeing them, I'm giving them information that's specific and pertinent to what they're trying to understand, then a rapport gets built, right? It's my responsibility to be useful to them and truly useful and see them and understand them. And that's my responsibility. And then assuming that I'm being effective doing that, a rapport gets built. Otherwise, if they're, sometimes people aren't that interested in help or therapy for one reason or another, and it's more difficult. But generally, people are there because they want to understand, they want to get better, they want to move forward, they're looking to create a new vision of their life, get back to themselves as they remember themselves at some other point in their life, which is common. And so the process takes, that form.
It's a very positive environment then that you try to foster there. And I really like how you have said this oftentimes, that you tend to go into treatment looking at the person and saying they want to get better. You're kind of assuming that right away, that they're here to get better and I'm here to help. And I feel like that's not always how people feel. They many times will run into situations where people are like, okay, you're going to fight me. I was like, really? No, I do want to get better. Yeah, come on. Almost as a setup.
I think the whole setup with Domus is very different than the traditional treatment centers. I think most people that work with us have not even worked on that setting, but on the healthcare setting. And one of the reasons I was trying to do that is so they would not have that hard drive that function as people are here, but they don't really want to get well. They're always lying. So I think that when you ask David, what do we accomplish there? I think we're very clear, number one, to the patients of what we are going to accomplish here. So we don't promise anybody that their life is going to change, that their spouse is going to change, their kids are going to change, that we are fixing all their mental health issues, social issues. We are telling them we're going to give them the best foot forward. And I think within that 10 days, 2 weeks they are with us, even if they do relapse, they know that they were respected, that life wasn't so bad without that substance, that they were treated like another human being and not a drug addict. And the food tasted good. And, they were able to relax. So I think that sits there. So again, even if they do relapse, or even, if physically they go through a hard time, they have that memory in their hard drive that it can be okay without it. And I think that is critical for the patient leaving him, because it's almost, you get somebody in this dark tunnel, and now they have the ability to turn on the light.
Claire, that's it. That to come back to your people come and get detox because they have some memory of themselves, of a better self, of a better life, of feeling better, and our job is to get them back there. And my job is to see that part of them and to see all of the difficulties, whether they're internal or external in their lives, that inhibit that from being sustainable, right? Because they're there to get back to some part of themselves that they want. And so the process is to help them feel that again, not just intellectually know their detox, but feel alive again and some sense of a home inside themselves, and to begin to create some vision of what it means to have a home inside and outside again that feels good to them, create some idea of what's going to support it, what the challenges are moving forward in maintaining that. And to do that, you have to see the person and see where they're at. And so that's really how I approach it. And I think the whole, like you're saying, Claire, that the whole philosophy at Domus is organized around these principles. And from the detox process, in which we try to get people detoxed as quickly, as safely, and with as little suffering as possible, because it is not the type of suffering that leads to people getting better. What leads to them getting better is feeling better, getting this difficult thing accomplished as quickly and as safely and with as much care as possible. And then that increases a sense of well-being and self-esteem and internalized value. That's the whole process.
Wow. I wonder if some of that comes from that mentality that you mentioned, which is a healthcare mentality, versus a lot of addiction treatment has a shadow over it of involuntary treatment or court-ordered treatment. And not to denigrate some of those programs that do exist, and having worked in some of those programs, I know that they can function well and can save lives, but it's a different, it unfortunately, though, within those same programs that I thought some good therapy was happening, there was also a lot of people who would approach it with almost that probation officer mentality. Even the social workers or even the counselors would get kind of into that cynical place to where it was adversarial.
I kind of don't think so, Dwight and David. Maybe you disagree with me. I think everybody wants to feel good. Everybody wants to be happy. Mm-hmm. Nobody wants to be a slave of any substance. I think when David keeps repeating, seeing people where they are is incredibly important, because most of these places, they don't see people. They see addiction, and they have that bad taste to the condition. And they have those principles of, again, stealing, lying, BSing, all the above. So I think when they speak to the patient, they already have that, reactive form of responding. Oh, you want more medication? Oh, you're going to have to handle how you're feeling. And I think it puts the patient in that place of responding to almost, the attack. It puts the patient in that place where they don't feel loved. They don't feel worthy of, not just of the care, but worthy of being happy. They don't feel capable. They are told that once an addict, always an addict. When you think about, 30, 60, 90 days, because people often say to us, like in the beginning you said, what can you do in such a short amount of time? I actually had a rehab. And again, I think people are different. Their DNAs are different, that they make up is different, their history is different. And I think treatment has to be different as well, because it has to fit the patient and not the condition. I had, I would say, when I started doing rapid detoxification, so you're probably talking 2 decades ago, the head of the biggest rehab in the United States called me and say, what the hell do you think you can do for patients in a week? Mm-hmm. And I said to them, probably more than you can do in 90 days. And I meant that. I meant that because although 30, 60, and 90-day programs are a wonderful business model. Think about that. If I have you at Domus for 30, 60, or 90 days and insurance is paying for you for every day, I don't have to worry about that bed being empty. Mm-hmm. What I do is having a patient for a week or two, I'm constantly worried how I'm going to fulfill those beds.
So it comes down to running the program for the patient or running the program for the program.
Correct. I am redoing our website, and I do most of the writing for the website.
Opiates.com.
So,
a little plug there.
Correct. It's a 25-year-old website. So I am going through a lot of the websites, from other treatment centers, from NIDA, different places, organizations that deal with addiction. And all of them say the same thing. The longer the patient is in treatment, the better the chance of recovery. If patients leave treatment before 30 days, they're very likely to relapse.
And I've seen that thrown in people's faces, too, sometimes, where if someone,
but that's what I'm saying,
for life circumstances, does leave, they're very much shamed for it.
The statements are discouraging. Mm-hmm. The statements are, how do they know? I know as a fact that if I left my job, my family for 30 or 90 days, when I come back, I'm not going to be able to handle what's going to be left here. Mm-hmm. So my work of 30 years will be down the drain. So, again, I think we need to start treating patients where they are, not based on our needs, based on their needs. And I think patients at Domus, they feel seen, they feel heard. And that's critical for somebody to feel some kind of self-worth. I think when they leave David's office, they say, oh my God, so many times patients say to me, David understood more of who I am or where I want to be than all therapists, all treatment centers I have been. All that is that David was there to hear them, not to tell them what to do, how to do it, but to actually understand where they are and start, walking with them from that point. Yeah. It's a relationship based on their needs. So if they left, we have mothers that had a baby a month ago or 2 months ago. And, for one reason or the other, they or relapse or start using opioids due to C-sections, whatever happens, and they come. I know they can't be here for an extended period of time. That would be detrimental for them and for the child. Mm-hmm. So, if we can get them to a place of stability and health, and they can go in 30 days, this person can come and, work for another week with us. I think that's wonderful.
People who need to stay longer, who are vulnerable, we allow them to stay longer. They can stay longer. We mm-hmm. will work with them. And if somebody needs a longer treatment, which some do, it is available. And so it really is based on understanding kind of where they're at. I mean, change begins with understanding where you're at, period. I think one of my favorite sayings was by Einstein when he said, imagination is more important than intellect. Most people are getting detox because they remember and imagine a different part of themselves in their lives, and they want to find that again. There's a lot of things that inhibit that. There's a lot of things that are complicated. Good things and bad things have happened often. And so there's stuff to sort through, and there's always ambivalence. I think it's what you were talking about, Dwight, before. The best way I know to approach ambivalence. So when people are there and they'll say that they want to get better, but you'll also see signs of parts of them at times that are ambivalent. They're not sure how much better they want to get, or if they do. And you have to get to know both parts. And it's such a relief to feel like you can sit and really talk to someone about different sides of your ambivalence. Like, yeah, there's a part of me didn't want to come or wasn't sure it was good or the right part, or, part of me that wonders, will I go back to it? And you get to know it and not judge it, but really try to understand that. And as you lay that out for them and they can get a look at themselves and get some sense of who they really are, you actually can creatively work with that. Because within that part of them that is ambivalent, there's all kinds of needs, all kinds of fears, and you get to sort of begin to pull this and see a human being in their fullness. We're grateful for it. Often they've never had it before. And so, I do see that as my work with them. It is in depth, right? As they're ready to sort of do that. And some of that can happen quickly, and some of that can take more time. So there's flexibility depending on what people need and want to do.
Flexibility is the right word over there that describes Domus. We're flexible to patients' needs. We're willing to change it if that is in the best interest of the patient.
And we're going to leave it there for today. My thanks, as always, to Clare and David for being there. My thanks to all of you for listening as well. You can hit us up on Twitter @opiates, or you can email us at info@opiates.com. As always, if you'd like to learn more about the Waismann Method and our approach to detox and treatment, you can go to the website opiates.com. This podcast is a production of the Waismann Method Treatment Center. Our music is the song Medical by Clean Mind Sounds. The show is produced by Popped Collar Productions, a company that helps you to get your podcast going. Check us out at poppedcollar.net. Thanks again for listening to us as we try to answer some of your and our questions about opiate dependence. Remember, keep asking questions, because when you ask questions, you'll find answers. And if you can find answers, then you can find hope. Bye-bye for now, and we'll talk to you again soon.